And I think that we're getting to the point where people are now starting to consider fascia as its own separate organ. Um, and that's amazing. And the amazing thing about that is that, as you'll see, we can affect fascia with the lasers that we have at our disposal. Okay. When your fascia gets sticky, it starts to look like this. And that you can tell the muscles can't really, they don't glide, right? It's supposed to be nice and loose. Here's fascia. Here it is when it's working. It's like a fishnet, like one of those things you put around a wine bottle when you take it out of Bevmo. And here you've got when it's all sticky, someone who's not moving around, not moving those muscles, it all gets all tight. And this happens even when you sleep, which is why you wake up feeling a little bit stiff sometimes. And fascial lines, we can see here that the fascial line on the frontal fascial line goes from the tongue all the way down the front of the body to the tip of the toes. This is all connected. Okay. So when parents say, well, what does this little tiny piece of skin matter under the tongue? I don't know. It could mean a lot of different things for your child. Let's talk about it. Okay. Listen, and if any of it resonates, let us know, which is how we've been presenting this to parents. Okay, so here are some links for fascia that you can watch. For some reason, this one is restricted because, I don't know, maybe it shows dissection. I couldn't figure that part out so much. It's just anatomy. But if you have a YouTube account, just sign in and it'll let you watch it. You can see that the fascia are actual little tubules. Okay, and those tubules are filled with hyaluronan. And when that becomes sticky, it crystallizes. Okay, and what you want is you want it to flow through that. So it's a conduit. So if we're thinking about these biophotons, biophotons, maybe they're moving along that. I have not looked into that research, but that is the thought process right now. And if anyone knows who Emily's Wonder Lab is, we did a giveaway of some of her signed books. I love her. She's got a couple seasons on Netflix, and she does experiments, and you can do it yourself. It's pretty easy. Obalek is a non-Newtonian fluid, and basically what that means is if you pressure on it, when you make it, it looks like slime, but it hardens. And as soon as you relax that pressure, it releases. So if you want to play this or do this with your kids, or even just by yourself, make some, and you can see those properties. And that's kind of a little bit like fascia, just a fun experiment to do. All right, and here we go. So what can we do? Now we're getting into treatment, right? So we're using our ND YAG, we're using our erbium YAG. We know we've got these muscles, we've got this fascia, we've got OMDs. What can happen? This top photo here is our light walker. And then I did actually also get this, it's called an X pulse. And this one allows us to do Babylase at much an easier level for the babies. They can tolerate it better. And we can use low-level light therapy, like the photobiomodulation that we talked about, or we can use high-level laser therapy, and that's Babylase, L.A.F.T.R, Oralase. Okay, and we'll start talking about that now. So here we go. Photobiomodulation, Photona did trademark the Comfort Lace. Oralase is there are legal cases right now trying to determine who can own that trademark. So there's a push to call it Smilelase, and then Dr. Ludeman, who I have a photo of later, developed this concurrently, and hers she calls L.A.F.T.R. Okay. Here is Dr. Nordstrom. He is the genius mastermind behind developing these sequences. And Dr. Angie Tenholder, who developed the Babylase with him and who teaches a lot of his teachings, philosophies, courses. He does orthodontics. If anyone knows the Alpha Appliance, Dr. Nordstrom developed that. Okay, and here's what he says. With normal integration and maturation of protective neonatal reflexes in combination with a healthy swallow and nasal breathing, it will allow the individual to efficiently posture in space, as well as move gracefully, sleep, and process daily events. Who doesn't want to do that? I want to do that. So what are we doing? We're looking at babies. When we're doing Babylase, we're doing an assessment of their cranial reflexes. We call it ACORN, assessment of cranial reflexes. Oh, I think I spelled that wrong. Anyway, so we're looking at what are the reflexes and looking at their timeline and saying, do they have it? Are they supposed to still have it? Do they have it a little bit? Is it bilateral? Is it unilateral? We're looking at all these things to see if along the milestones that they're supposed to have been hitting, were they able to hit them in order? Were those neurological connections able to be strengthened? Or did they maybe kind of go here, there, everywhere, and, not kind of doing any or some of it as strongly as they could potentially be? When we're looking at the babies, we're also doing an assessment of their lips and jaws. So we're looking at the muscles, we're looking for OMDs, we're looking for nursing and figuring out what could be the issue if mom or baby is not feeding well or having difficulty during nursing. When we're talking about kids, we're also looking at some of the same muscle areas. And we're also starting to ask questions along the development, that individual development that Dr. Nordstrom talked about. Are they feeling nervous, sad, restless, picky eaters? Are they anxious? So on and so forth. With adults, similar. This is a little bit, with adults, you've got lifetime of doing things this way. So sometimes adults don't even recognize that there's a different way to do it. Okay? And here, this is Dr. Nordstrom and what he says about the anterior coupling response, or the ACR. And essentially what he's saying is that when everything is moving the way that it's supposed to in an inherent rhythmic motion, then you can move up on the higher levels of sophistication with your volition, which is the development of your personality. Because your brainstem rhythm is generating centers hierarchically. I get tripped up on some words, hierarchically and hyaluronic acid, H words for me. And what that's that fifth point that I was talking about, right? So the way that we're meant to develop is also part of the personality development, and everything needs to be moving in the same, in coherence, in order for it to function as well as it possibly can. Okay, so ACR is a core player in the co-development of resilience, individuality, self-regulation, independence, and your sense of self. And what does that mean? That means that physical and emotional resilience are the outgrowth of the natural development and refinement of three-dimensional postural stability and grace. This is proprioception, right? And a healthy swallow is critical in reigniting and perpetuating this rhythmic motion. So that is what our overarching goal is, right? And myofunctional therapy and Oralase and PBM is getting the individual back into that rhythmic motion so that everything can continue to develop properly. Dr. Nordstrom talks about this website, solvinglearningdisabilities.com, where they talk about primitive reflexes and how some kids that exhibit some of these brain-based learning disorders are showing that they have retained primitive reflexes that have not disappeared. So what that means is the connections that they were supposed to have made to move on to the next step, for some reason, didn't make it there. And so this website has a lot of checklists and a lot of symptoms for you to look at. I didn't put them all down here, but here are some of the reflexes to check. And here's a timeline of when those reflexes are usually expected and when we expect them to have already been able to move past them. And let's do one right now if you're still with me. So just put your arms out like a starfish. And without thinking, on the count of 3, I want you to just curl up and cross your arms and your legs at the same time. 1, 2, 3. So look down. Which arm is on top and which leg is on top? If you have the same side, you've moved past your Moro reflex. If you're opposite side, you have a retained Moro reflex. Okay. And this is what babies do when they get startled, right? When a baby is lying there and it gets startled, it immediately curls itself up. But it's supposed to be able to integrate across the midline, which is why a lot of baby songs have lots of things going across to teach them how to be able to cross their midline at the same time. Okay. So here we've got right on top, right on bottom, left on top, left on bottom, and here is an over-retained moral reflex. Okay, so what can we do about this? So Oralase, I'm only going to call it Oralase, okay? The Oralase recognizes that this oral facial zone is central to the body's natural integrative process in order to help develop this resilience. So what we're doing is using a specific wavelength of the ND-YAG with a specific intensity and a specific pulse shape along a specific sequence of strokes in order to create a comfortable and pleasurable sensation that activates the primitive responses. And what does that do? It releases oxytocin. It opens a limbic window. And I'm going to talk about what the limbic window is in a second here. And when you open the limbic window, you can access cortical memories that can be coordinated with the cerebellar patterns to allow old traumas, developmental inconsistencies, and frustrations to be dealt with by the body, to be integrated and to be processed. So you take these traumas and these gaps in the neural development of individuals, and by using the laser and stimulating along these neural patterns, the cranial pattern, the vagus nerve, we can get, help to get past those traumas and gaps. So if you don't do that, you perpetuate what's called limbic hypervigilance. Okay. And here we go. You've got the autonomic nervous system, again, high school science class. We've got the sympathetic autonomic pathways. We've got the parasympathetic autonomic pathways. This is, you see a bear, everything shuts down. You're going to focus, you're going to flee. You've got all of this adrenaline. This, you got a nice comfy teddy bear. Okay. You stimulate the vagus nerves, you downregulate. This is what all of these apps are, trying to get you to breathe, to meditate, get yourself out of that hypervigilance state where you're always like this. Okay. And a healthy ANS is able to shift between the parasympathetic and the sympathetic back and forth without having any trauma. But if you've got unresolved trauma, you can see how maybe that doesn't happen so easily, right? It may take you a little bit more, or maybe you can't get there. And so you've got people and individuals that are in this high state of anxiety. And what can we do to help get them out of that? And this is where the laser therapy comes in, because by using high level light therapy, by getting the light into that fascia, releasing those hyaluronic crystals, we said it this time, you allow the muscles to glide, you get warmth into the muscles, you melt that fascia, for lack of a better word, you strengthen the neurological pathways, you downregulate the sympathetic system, you upregulate the parasympathetic system by stimulating the vagal nerve, and you open the limbic window so that you can release trauma and get emotional healing. There's also something called Hinsler, and I'll talk about that in a minute. Okay. So here is the limbic system. If you don't know what it is, basically, it is the part of your body that you do not have conscious control over. Okay. And the information goes into all of the different parts of your brain, and what we call it lower order emotional processing of input from sensory systems. So because the laser is stimulating that, it is allowing that limbic system to open up and to heal. So this is Hinsler. Hinsler is also a different way of using the same wavelength. It uses not just the wavelength, it is a contact and it is pressure. And so it's using both the laser and the compression in order to get that laser energy deep into the tissues. And if you use it on target points, on pressure points, you can start to get release of that and healing of the muscle and the tissue in that area. Okay. So what is all this? I talked about proprioception. If you know what kinesthesia is, kinesthetics, proprioception, it's your ability to locate where you are in space. And a lot of the symptoms for individuals who cannot do this well is what you call like quote unquote clumsy, right? If you can't do that, you don't know where you are in space and you don't have that proprioception, then that could be one of the indications that maybe there's something to look at. Okay, so over 90% of the input to the brain is proprioceptive, and it's called the sixth sense. The nerves are bidirectional and in all the fascia, which again is starting to be considered a sensory organ system. The tongue, vision, and vestibular system have a critical influence on your posture. And if you have abnormal movement perception due to strain, fascial desensitification, laxity, or joint derangement, you can activate local and central protective reflexes to offset the spontaneous healthy posture and function. That's a lot, right? That's a lot. And it triggers autonomic compensation and limbic filtering. So the laser therapy, what do we do? This is the instructions for pre-laser therapy. I'm not going to go through all of those. You can read those, but basically treat it as if you're going to a spa. Best results are to play afterwards, not to do anything stressful. Give yourself some time for self-care, even if it means just sitting in the parking lot or sitting in the car or taking a nap or meditating, whatever you can. That is how you're going to help integrate a lot of the benefits of the laser therapy. Here are some of the common sensations. We get profound sense of calm and connectedness, impulse to smile, sing, dance, and snack, immediate resolution of pain and increased range of motion. If you're seeing a myofunctional therapist or you're getting body work done, it's a good idea to see them shortly after one of these sessions so that you can get maximum effect of your therapy with them. And obviously continue to wear any oral appliances. Here is Dr. Ludeman, who developed the L.A.F.T.R, Dr. Olivi, who is a laser guru. And this is when we start to use the lasers for surgical procedures like frenum releases and so on and so forth. And that's a different topic for a different day. Nightlase coming soon. Here you see how we can use the erbium and the ND-YAG. Here's someone who's snoring. You can see don't have a ton of airway space. The soft palate is really low, not very, a lot of, what this does is it induces collagen formation. So you get a tightening of that tissue, some opening of the airway. And here you have an example of pre-nightlase and post-nightlase. You can see how much the airway has opened up, okay? And this is all as non-invasive as possible. It's just using the lasers, okay? No surgical component to it. There are 2 steps. It's usually 3 separate treatments over 6 weeks, and the effects have been shown to last about a year. And again, we'll probably start offering this in the office in the summer to fall of this year. So all those people that I talked about before, we need everybody to figure out where to start, what to start with, and to create an individualized treatment plan. So it's hard to answer when someone asks, well, my child snores, what do I do first? It's neither here nor there. You got to do kind of, is it a space issue? Is it a tone issue? Is it a tongue tie issue? Do you have to see a myofunctional therapist? Does a body worker need to be involved? The laser therapy could be useful, so on and so forth. Here we've got some quotes from some people who have done it. Do I have time to read it? I mean, I'm way over anyway, right? Okay, so my 4.5-year-old son did 7 sessions of Oralase with Dr. Lopez over the course of 2 months in preparation for a tongue tie release surgery. 4 sessions led up to the surgery with another session immediately after and follow-ups 2 weeks later. My son was super comfortable with Dr. Lopez as she thoroughly explained everything to him before she started, tested the laser on his hand to show him it wasn't painful, and also made it playful and fun for him. She put him at ease so that these sessions were not a dreaded event. She also put me at ease as a parent, having no idea what the treatment was about. He was very relaxed during these sessions, almost like he was at a spa. and always left the office in a pleasant and calm mood. He seemed to quite enjoy it. Measurements taken before and after each session showed a greater range of motion with his mouth and tongue each time. When it came time for his surgery, my son was ready both physically, being able to make and hold certain positions with his mouth and tongue, and emotionally, as he had to be awake for the procedure, but was absolutely compliant and showed no sign of fear. For context, a year ago, my son would barely get into a dental chair for a simple cleaning. He also healed from the surgery very quickly and without pain. We did Oralase as part of a multi-tiered approach to correct speech and oral posture. In conjunction with myofunctional therapy and the tongue tie release, my son can now pronounce sounds like L and S that he was unable to before. He used to be an open mouth breather in his sleep, and that has also improved. Although it's difficult to measure the tangible impact, I do firmly believe that Oralase has had a positive effect on my son's oral development. This was one of our patients. And yes, this was the office that he did not want to come and sit down for, just for a simple cleaning. And he's loves coming now. It's amazing. Here's another family. Oralase has been a blessing to our family. It's an easy, relaxing session that immediately shows results in flexibility and is improving my son's movement and sleep the more procedures we have. In fact, my child's myofunctional therapist saw such great improvements in his mouth with only having done the laser and no other interventions. I'm so glad I've chosen this therapeutic path for many reasons. It's not only addressing my oldest child's immediate needs of relieving tension and stress in his facial muscles, but it's investing in his future by allowing his jaw and mouth to develop properly and avoid future sleep/breathing issues that many people develop later in life. Good deep sleep and nasal breathing is the pillar of health, and Oralase directly supports his healthy future. He has relieved tension and no longer complains of headaches. My 4-year-old son's sleep has definitely improved since beginning treatment. He's sleeping better through the night and has stopped his cute but unhealthy snoring. He looks forward to Oralase sessions. For myself, the Oralase has relieved my TMD and has helped me relax my jaw fully. My jaw hasn't felt this great in years. It's also addressed painful trigger points in my shoulders. I've been sleeping very deeply as well. This is another family where we have the 2 sons coming. One of them is going to need a release. The younger one is still debatable, and mom has also had a few sessions for herself. Last one, and this one always warmed my heart. This is an 18-year-old patient of ours. Since we last saw you, things have improved dramatically. M started working out, drinking protein, eating healthier, acting happier, engaging with family. He took a full-time job. He is working for a luxury cabinet shop, building and finishing cabinets. He is excited to learn. He's up at 6:15 a.m. He's lifting weights every day. He's looking forward to things again. I have no idea what role the light therapy and you played in this, but I felt like I needed to give you this update and tell you, thank you so much. You've been an amazing blessing to my family. I hope your holidays were lovely. Thank you for all that you do, and thank you for caring. This patient didn't have myofunctional therapy, wasn't being seen by a body worker, just needed a little bit of help. And after 3 sessions, we had to cancel the 4th session. It was right around the holidays. And this was a surprise email from his mom when I got back from my vacation. So this is what Dr. Nordstrom looked like back in the day when he was doing all his research. Human beings begin life with an innate sense of self. The more we learn about nature, its normal patterns of development and individualization, how and why things actually intended to function, and how our patients adapt or cope in response to trauma, abnormal development, or faulty genetics, the more effective we can be in designing treatment to recruit and support nature in getting each patient on track to become their best self. And those 3 reviews I just read, all of those patients are becoming their best self. We actually had a patient come in with mom yesterday, and we look forward to having mom talk about it because she had a lot to say about how her daughter was affected in so many different ways. So we'll talk